Hi, it's Sin from Sin City Neuro NP. I'm a neurology nurse practitioner here in Las Vegas, Nevada, and I practice mostly inpatient neurology with a little bit of outpatient as well. And I like to do short little educational videos for new NPs, PAs, and anybody interested in learning a little bit about neurology. Today we're going to be talking about cerebellar ataxias. So ataxia is just discoordinated movements, and then your cerebellum is the back of your brain. So this would be different from the peripheral vertigo and things like this. So this would be our central vertigo, kind of what we discussed before. So this would be your cerebellum is malfunctioning, and your cerebellum's main function is balance, coordination, just kind of coordinating those movements. So maybe not, that sensory stuff. So you may have normal sensory, normal strength, but all of a sudden, just your movements are just out of whack. There's primary and secondary cerebellar degeneration. So primary cerebellar degenerations is when the cerebellum itself it's slowly degenerating. And that could be just primary cerebellar degeneration. That can be hereditary. It can be idiopathic, just kind of spontaneous. Then like Friedreich's ataxia, multiple system atrophies, Spinocerebellar ataxias. So those are in that primary cerebellar ataxias. Then those secondary cerebellar ataxias, these are acquired or reversible. So acquired would be things such as alcoholic cerebellar degeneration. So alcohol over time degenerates your cerebellum and causes ataxia. Then there's toxic. So toxic would be things such as drug use, medications. Phenytoin is one of them. Phenytoin, dilantin, over time causes cerebellar degeneration. Lithium toxicity, vitamin B1 deficiency. So these are all acquired or reversible. Strokes. So strokes can cause cerebellar ataxia, but it's not a primary, it's a secondary because it's acquired. And now you have cerebellar ataxia from the stroke. Tumors, anything that's just now affecting the cerebellum, but not primary. And some of these things that are secondary causes, you can possibly recover from them because they don't typically progress if you're able to stop whatever is causing that degeneration. There's also perineoplastic. So let's say you have breast cancer or a history of breast cancer, and those breast cancer, they're producing these antibodies, anti-Yo, calcium, voltage-gated calcium channel antibodies that are binding and affecting the cerebellum, and you need to be treated for that. And those are reversible. Then there's those primary degenerative ones, and they're non-reversible and usually are progressive. So those are your ataxias. And what is ataxia? So ataxia is, like I said, coordinated movements, vertigo, so that sensation of movement when you're not moving. So overshooting when you are doing finger to nose testing, wide gait. So wide-based gait, things like that. So those are those ataxias. And so some testing that you would want to do is just start off with brain imaging. You can generally see atrophy in those primary degenerative and sometimes in those secondary as well. So you can see either a lesion or something there. And sometimes you cannot. And that's where it comes into those things like the perineoplastic things. But based on their symptoms, you can differentiate between peripheral vertigo and central vertigo. So that is kind of a quick spiel on cerebellar ataxias. So there's those primary degenerative, and they are progressive, unfortunately. And then there's those secondary, which can be sometimes reversed or at least become stable. Now, the thing with the cerebellum is how the rest of the brain is contralateral. So this part of my brain, this hemisphere of my brain controls this side of my body. The cerebellum is different in that it controls the ipsilateral or same side. So this kind of, the main portions of my brain, these are contralateral. Okay, so my left hemisphere or right hemisphere controls the left side of my body. Left hemisphere controls the right side of my body. Your cerebellum, same side. So my right side of my cerebellum, if that goes out, it's going to affect my right side of my body. And so that's something that you'll find. You do an MRI and somebody has a cerebellar stroke, ipsilateral symptoms. So that's, just of note. Okay? All right. Well, this was just a quick thing. If you have any specific questions about cerebellar ataxia, just leave a comment.